Hi, good afternoon, everyone. My name is Dr. Zeeshan. So today we're going to be discussing about health, heart health, and today is actually Heart Health Day. So we're going to be actually briefly talking about, uh, different what is heart health, the symptoms, the risk factors of heart diseases, different types of heart issues. What is blood pressure? Why is blood pressure important? Why is looking at your lipid profiles important? And some factors that can help you have a healthy heart. Okay. So we will actually look at what is, why are we discussing World Heart Day? Because heart disease is the leading cause of death in the world. So around 18 million people die each year of heart-related issues. Around majority of the issues that patients do have is cardiovascular diseases. Now if we look at the first slide, now what is heart health? It's it's number one cause of death, right? um, is heart attacks, okay, and strokes. I'll explain to you later what we mean by what is a heart attack and what strokes are. Okay. Now, what heart itself, it's an organ that basically pumps, like even before the child gives birth, it's working, and it's the most hardworking muscle in our body. Roughly, a heart basically pumps. Hello, hello.
Yes, Dr. Zishan, you're audible.
Yeah, I'm audible. Okay, so
Yeah.
when we basically say that it's the hardest working muscle in the body, it pumps around 5 liters, 4 to 5 liters every minute. So this is actually when we say it pumps 4 liters every minute. So there's, if you look at the calculation, it's called cardiac output, right? It's calculated by stroke volume times heart rate. Okay, stroke volume is the amount of blood that's pumped. Okay, every time the heart beats, that's called as stroke volume, right? And the heart rate is basically every time the heart beats. So it's a calculation. That's why how we get 4 to 5 liters. And so roughly around 4.9 liters, right, of strokes that the heart beats. Now, when we discuss about heart diseases, right? uh, Heart disease itself is very silent. Okay, so no one actually knows that they have certain types. If they're having a heart attack, heart failure. Yes, gradually you will have some symptoms that can tell you, but it's very silent. Okay, and especially in if anyone has any comorbidities such as diabetes and other factors. But when someone has a heart attack, they will have pain such as chest pain, discomfort, jaw pain, left shoulder pain, uh, nausea, vomiting, body aches as well. Okay, so every individual varies. Okay, um, there's no specific sign that anyone can have when they're having a heart attack, yet, but every patient varies. Uh, if a patient is having comorbidities such as diabetes, they won't have anything apart from like they can just walk in and just have like nausea or vomiting, some epigastric pain, discomfort. So looking at this slide, that's what we're saying is that it's silent. So eh, some patients won't even have any symptoms like that. They'll just have like gastro type symptoms, right? Uh, so now looking at the risk factors for heart diseases, there's multiple factors that we can actually look at when we want to actually rule out if someone has risk factors, right? So go back. Sorry about that. So we have several risk factors. Now, I'm going to go over these one by one. High blood pressure, high cholesterol levels, smoking, diabetes, overweight, unhealthy, sedentary lifestyle, and excessive alcohol use. Okay, these are basically the risk factors that we look at when when we want to say if someone's having they're prone to having a heart disease. plus family history is also there. Okay, these are also known as risk factors. I want to just point out diabetes is very, everyone needs to look at all these factors. They play a very important role, right? If someone has a high blood pressure, right, it will lead to, a cardiovascular event if not controlled properly. Same thing with high cholesterol, smoking. Every single, factor that's presenting on this, slide right now is important, and you need to actually look at, if you have a high cholesterol, you're taking proper medications. If you're a diabetic, your medications are taken on time. If your sugar levels are not too high, you can actually control your diabetes with exercise, uh, dietary modifications. Blood pressure, you also, I will discuss in the next few slides. Smoking, okay? Now, when we say what is a heart attack and what stroke is, stroke is basically the blood supply or less oxygen to either the heart or the brain. So when we say a heart attack, it means that there's less blood flow to that area and oxygen is not present. So if you look at the first slide on top, this is how a normal blood flow is. Next is when there is either a plaque formation, which is known as atherosclerosis, and this happens with time. You have a trauma in the artery, there's a clot formation, and if any individual they have high lipids in their blood, or they're having other factors such as diabetes, they're having high blood pressure. All factors play a role. And in the last slide, you have a blockage. Okay. And this is like a clot formation, either in any of the arteries in the heart or in the brain. This will cause, if you look at the last slide, this will cause a blockage, right? When you have a blockage, it means less blood flow to that particular organ, right? And that will cause that that part of the body not to have oxygen, and then you'll have pain. This is what basically what a heart attack and stroke is. Okay. So let's look at the blood pressure, which is a very important factor in heart disease now. Normal blood pressure ranges from age to age. Okay, so systolic blood pressure and there's a diastolic blood pressure. Uh, any individual who has a high blood pressure, okay, when we say there's hypertension, right, when we label someone as hypertension, it means that their blood pressure is above 140 over 90, right? But one high reading doesn't label anyone as a hypertensive individual, right? If you have a high blood pressure, you should seek, physician, speak to anyone, go see your physician, have your blood pressure monitored on a regular basis. We have different ages where you should have a normal blood pressure ranging from 130 to 180, 120 to 120 to 80, and we have different classifications. Okay. Um, Whenever you do have a readings which is high, does not mean you have hypertension. I will repeat this again. You will, if you have readings 2 to 3 times, you will go see a physician. They will actually do lifestyle modification, put you on diet control, have you lose weight, exercise, low salt diet, less than 3 grams, and monitor you from there. So blood pressure itself plays a very big factor in any cardiovascular event. Okay. Now, if we look at, we were discussing the risk factors. We've discussed high blood pressure, why it's very important. Uh, within the arteries, you also have other factors that play multiple roles, but we're basically just looking at major risk factors, right? One was hypertension, we just discussed. The other one is now cholesterol. What is cholesterol? It's a waxy, fast substance that made by the liver, and some foods it contains cholesterol. When you have high levels of cholesterol, when you do have a trauma within the arteries, this will cause this will cause a trauma to the arteries, right? And high blood pressure can do that as well. So this will cause plaque formation. Okay. Uh, but just because one reading of high cholesterol lipid profile, meaning you have different types of cholesterols within your body, you have the HDL, you have the LDL. Now, when we look at when we look at HDL, this is low density lipoprotein. These are actually bad for you. Okay, so meaning that if you have a high percentage of this will cause you to start having atherosclerosis within the arteries, and it doesn't happen right away. It happens with time, okay, gradually, and then you have the HDL, which is the high density lipoproteins. These are good proteins, okay, lipoproteins. They help you actually take the bad cholesterol and actually store it into the liver. So well, again, if you look at the last comment that they've actually put, is that high blood cholesterol has no signs. Okay, so only way you will know that you have hyperlipidemia is if you do a lipid profile, which will have different parameters: total cholesterol, LDL, HDL, triglycerides, and that will be managed, effectively by your physician. Again, we'll start off with dietary modification, and if the physician feels that your cholesterols are too high, then they will actually put you on medications if needed, right? um, Going to 7 healthy tips that you need to actually look at when you do feel that you're having risk factors is: don't smoke. Okay, any sort of smoking, okay, you should avoid. um, any cigarettes, when you say vaping, shisha, avoids having any types of smoke that basically, they all have different types of chemicals, carcinogens. These are just a slide that we've just made, so it tells you that please avoid smoking, okay? Using any sort of tobacco as well, smokeless tobaccos, shishas, now they have vapes. Avoid anything, okay? Now, when we, yeah, looking at the World Heart Day, eating healthy is very important, right? Uh, Junk food, as we all know, what's bad for us, right? We should have whole grain foods. You should have brown rice. We should have oats. We should have fruits, vegetables, and low dairy, skim milks, low fat milks. These are just some lifestyle modifications to having a healthy heart, right? Eat healthy, okay? Have fish rich in omega fish oils like salmon. Okay, there's multiple other foods there. They're present, but we're just labeling a few that can help you understand that eating healthy makes a very, very big difference. Okay, uh, of course, red meat. Avoid having red meat. That basically doesn't mean that you can't have red meat, but yes, you eat healthy. Okay, have fruits that are rich in grains, have vegetables, and eat proportionately. Okay. Last but not the least, please avoid any type of carbonated drinks. We all know Pepsi's, any type of um, fruits rich in sugary should be avoided. Um, let's go into this. This slide actually was actually put because whenever you do go to the supermarket, we need to understand what we're eating, right? So always look at your labels, look at the calories, see the total amount of saturated fats, trans fats, total cholesterol, sodium, everything. Whenever anyone goes to the supermarket, look at what you're eating at. Uh, how many servings there are, the calories, what do they have, what how much percentage of vitamins are there, any type of minerals. So this actually slide was put so we actually know what product when we do buy it, what does it have in it? Does it have trans fats? Does it have cholesterol? How much sodium are we having? How much sugar are we having? 5 grams of sugar is too much, understand, depending on the product that we're buying. Okay. Uh, Being physically active, not having a sedentary lifestyle is important as well. Everyone should be actually working out maybe 4 times a week, at least 150 minutes, as per the American Heart Association. Why? We're working, in the office, sitting on majority of the people in UAE now are, having desk jobs, working 9 to 5, 12-hour shifts. But no, start becoming active, right? Go to the gym, go for a brisk walk. At least physically, it helps you in all aspects. It improves your mood, and it helps you sleep better as well. Okay. And last life for children, and even children now, every child now is just playing games. They're on computers. They should be actually having at least 30 minutes of exercise, going out to the park, running, skipping, anything that makes them active. If you're in the office and you're taking the elevator, so if you're on the second floor, when you're going to the office, you can take an elevator, but when you're going home, you can take the flight of stairs down. uh, just promote being active more. um, Different types of ways you can start doing some exercise regularly. Start doing swimming, bicycling, any types of sports, tennis, basketball, anything that basically helps you have physical activity should be promoted. uh, Even dancing and yoga. uh, these are just some slides that we put up, so we understand that mainly we should be active. Okay. Lastly, we always need to look at our weight as well. That's a very important factor. Please look at that your weight is uh, monitored regularly. Go when you do see the physician, have your BMI checked, look at your fat percentage. Are you having, your body mass index is basically monitored regularly. If you do need help, you can go see a dietitian. Okay, someone to help you maintain your weight, because high or obesity will actually lead you to have diabetes, heart disease, even high blood pressure, and even asthma. Okay. Uh, Stress itself is very important as well. It will actually, these are the main factors that actually a lot of the patients are having now. Stress itself can cause a lot of issues. So if you do have stress, okay, address it. Okay, have different techniques that can help you. If you're at work and you have stress and you're having a situation, talk to someone, walk away from the situation, take a break. Okay, if you have a routine which is very hectic, give yourself a break. Go for a small walk. Yeah, you don't feel that there is something, speak to someone. uh, Always seek advice. Okay. Sleeping itself, please understand that one of the biggest factors, people that have any cardiovascular events, is they either sleep too much, they're inactive, or they're sleeping too less. So at least 6 to 8 hours of sleep should be there. Okay. And having a good night's sleep, make sure that you make yourself stress free and have enough sleep. Not too much of sleep, not more than like 9 hours, but having good sleep from at least 7 to 8 to 9 hours. Okay. One more thing is that snoring itself, there are certain conditions that, like sleep apnea, that can actually cause you to have um, some health issues, and you might not be sleeping well. So then it's best to go seek medical advice so they can help you. Okay. Uh, Now, when we say regular screening, what do we mean by regular screening? We mean that we need to actually have your blood pressure monitored regularly. Okay, have your lipid profile done on a regular base. Look at your sugar levels. So, whenever you do want to get a screening, call your healthcare provider. Ask them, can you please just do my screening so I know that I'm not at risk. uh, as I've already mentioned to you before, different routines that we can actually get done is lipid profile. It's mentioned total cholesterol. So usually you don't need to do all of the lipid profiles. Mainly just do the total cholesterol, the LDL, the HDL to note. Do you need to have all of them, all of your lipid profiles checked regularly? Screen your blood pressure regularly, once to twice a year if you don't have hypertension. Okay, so what the summary for today, so I want everyone to understand is that these are some things that I would want everyone to actually take home message for today's lecture is, uh, Don't smoke. If you're smoking, if you need help, seek advice. Try to cut down on smoking or stop smoking. And if you're eating unhealthy, eat healthy, stress-free lifestyle, sleep well, exercise, and have good eating habits. Okay, and seek you know advice from a healthcare provider. We at TrueDoc, we're basically offering services such as you can consult a doctor online, speak to a healthcare professional, and we do offer different tests such as looking at your screening tests. We do everything over either audio or virtually. We do offer these services, so you can call us and discuss your thing with a healthcare provider, any doctor. TrueDoc is actually, there's a physician always 24 hours. There's a physician available. You can speak to them and see and have a discussion with them. Do you think I need to have this test done? Do you think I need to do this? They will tell you. They're all well qualified. Also, we do have psychologists on board if you feel stressed. Oh, and we have a wellness advisor as well. She's there if you do need any dietary modifications. You need a diet plan. You need someone who wants to lose weight. She's there for you. She'll be able to help you. If you're having stress at work, you want to speak to someone, a psychologist will book an appointment for you, and you can have a consultation with her, and accordingly, you can actually book an appointment through TrueDoc. We have our this TrueDoc. You can actually download the application, speak to a healthcare provider. If you just even need general advice, call us. We have physicians on board. They can give you advice regarding, if you're having any type of any issues regarding to even cholesterol, if you feel that your cholesterol is high. And we actually call back if you do want us to call you back after 3 months and you feel that your cholesterol is borderline. We will actually do a follow-up after 3 months, and you can have your lipid profiles done. And we have records of every patients that call us regularly. Okay.